Hello, and thank you for joining us today for the second installment of the Humana Foundation Symposium series, a fireside chat with Tom Kamber of Older Adults Technology Services and Walter Woods of the Humana Foundation. I'm Jasmine Weatherby with the Humana Foundation, and I'll be the moderator for today's event. I'll start by giving you a little background about today's speakers, and then I'll let the gentleman take it from there. You will notice that there is an email address on the screen for questions. If you are connecting from outside Humana and have questions that you'd like to ask during today's event, please send them in. Humana associates can send their questions through Buzz. First, I'll introduce Tom Kamber. Tom is the founder and executive director of Older Adults Technology Services, OATS for short, and Senior Planet. He is a leading expert on aging and technology who is regularly featured in national media and has presented his work on 5 continents. Under his leadership, OATS and Senior Planet have provided award-winning programs for older adults across America and are now charitable affiliates of AARP. He has taught courses on technology, urban studies, and philanthropy at Columbia University and is widely published in professional and academic journals. He is a co-founder of the Afro-Latin Jazz Alliance, which has won multiple Grammy Awards, and serves on several nonprofit boards of directors and public commissions. Walter Woods is the Chief Executive Officer of the Humana Foundation. The Humana Foundation's mission is to co-create communities where leadership, culture, and systems work to improve and sustain positive health outcomes. He leads all efforts to improve and sustain positive health outcomes, including partnership development, strategic investments, and community relationships. Walter manages all disaster philanthropy efforts across the Humana footprint, as well as partnerships with peer foundations that touch on similar issues affecting this geographic region. Leading a team of 7 and managing $437 million in assets, Walter transformed the foundation's model from a funding focus to an investment focus. Doing so allowed him to streamline the foundation's workflow, enabling a scalable investment giving strategy. By focusing on local, Louisville-based nonprofits, Walter succeeded in his goal of establishing strong roots within the community. The new strategic community investment process he implemented further enabled the Foundation's community outreach efforts. Now that the audience knows a little bit about each of you and the organizations you lead, Walter and Tom, can you tell me how your relationship started and how long you two have known each other?
Tom, I'll let you start.
Sure. I'll take that one. I met Walter, gosh, it's got to be close to 10 years ago. He used to be at the AARP Foundation and was the vice president there that was in charge of focusing on social isolation and building a model for finding different kinds of partnerships that would enable them to increase the social engagement of older adults. And we got a chance to work on a project together back then, and I learned a great deal from it. And it actually set OATS on a path to increase our focus on social isolation as a feature of our work, and also to build more sustainable metrics around measuring success. Walter left AARP back then, and we reconnected when he was at the Humana Foundation when they were converting into a model that was really focused on a sort of investment approach and an outcomes orientation. And we were able to start partnering again with when OATS applied to the Humana Foundation for grants.
And I remember meeting Tom in an ideation session. We were having leaders come to Washington to help us understand solutions in the social isolation space. And I remember being struck by Tom's intellectual curiosity, his outcomes and results orientation, his action bias, and his humor. Tom was very humorous, and we connected through that session and have been connecting ever since.
I do remember that session as well because you actually had a napkin and you were drawing on the napkin like one of those, internet entrepreneur type guys. You came over, I've got this napkin. I want to write an idea down for you. So we had to stare at the napkin while you diagrammed social change for me.
All right.
But it was a good start though. Actually, I still remember what was on that napkin. So not bad. Good pitch.
Okay, so your all's relationship really precedes the work together with the Humana Foundation and with OATS. Can you tell me how long the Humana Foundation and OATS have been partnering and how that work started?
Yeah, I'll take that one also. When the Humana Foundation created an RFP to request proposals from nonprofits to do work oriented around social determinants of health about 3 years ago now, Walter. Mm-hmm. And they were focusing on the bold goal communities, a series of cities that were really important to the Humana universe. And organizations were encouraged to apply to any or all of them with any kind of program to work on social isolation. And at the time, OATS had been working really intensively on a metrics-based model where we were training seniors to use technology to access social networks. We actually had a course called Connect that was the really intensive version of Connect was a 6-month-long engagement with older folks. And we would find people who were isolated, who had gone through a life transition typically and maybe they had lost a spouse or retired and were looking to rebuild their social networks. And we would give them this very intensive program and measure before and after what kinds of connectedness and social isolation factors and loneliness measurements might apply to them. And we found that we were moving the needle. So we're very excited about our ability to do this. And so when Humana put out this RFP, we were able to apply for it. And we decided to concentrate our efforts on one city. And so we actually did like a national survey of different communities that were on the list. And we pretended that we were important enough that they would care, which turned out to actually be true. But at the time, it felt a little cheeky because Amazon was doing the same thing around that same time period. They were going around saying, what is your city going to do for us at Amazon? And we were going around to people saying, hey, we want to come and apply for money to come into your community and solve for social isolation for older people. Can you support this? What kinds of projects and programs can we plug into? And we found San Antonio, Texas to be the most responsive, the most kind of agile and committed environment for us to work in. So we applied for the grant, and we only applied in San Antonio, Texas for a major project, which was kind of rolling the dice a little bit because it didn't, our team was a little worried that they weren't going to commit to that kind of outcome orientation in a place like that. But we were able to get the grant, and it started a project there where we were able to launch a full citywide operation in San Antonio for Senior Planet, train people all over the city, really enhance our measurements so that we were able to work with people at the Humana Foundation who are experts in the outcome measurements and the statistical point of view that allows us to know we're making a difference. And that has turned into this incredible working relationship that we have today.
And Walter, do you have anything to add to that, or?
No, not, just that, again, we are looking for leaders that are thinking differently about the impact areas that we're focusing on, who are pushing the envelope, who are being creative and collaborative through their solutions, and Tom and OATS definitely fits that bill.
So, Tom, can you tell us a little bit about the changes that you've seen in San Antonio as a result of the Senior Planet work there?
Sure, I'm happy to do that. Well, first of all, San Antonio, I want to give them some props here because San Antonio already had, I think, arguably the finest collection of senior services programs in the country. For a city of their size and possibly even for any city. It's really an amazing place that has comprehensive senior service programs. They have these incredible centers that have technology. They have, fitness centers, and they've got meals programs, and they've got social workers. And it's really a very collaborative city. It's also a city with some strong philanthropic and nonprofit collaborations going on. The Salsa Foundation, the Area Foundation there, and the mayor is really involved in city council. But what they didn't have when we got in was a really strong technology program. And they didn't necessarily have a way of connecting that with the sorts of measurable outcomes that we had been working with at OATS. And so we came in and launched Senior Planet programming in partnership with all sorts of community organizations. We didn't build our own Senior Planet Center right away and start bringing people to us. We went out into the community and partnered with already existing leading organizations. We made sure that all of our curriculum was available in Spanish because there are a lot of Spanish speakers in San Antonio. And we began teaching these basic courses, but also, of course, a lot of our trainings are about using technology for a purpose. And the purpose, of course, in this case, the highlight was how can we move the needle on people's social isolation measurements? And it's not just whether a person feels lonely. That's the subjective measurement, right? A person can say, there's actually a great questionnaire from UCLA that we've been using a portion of that to test this. But a person might themselves not feel lonely, but still not have very many social contacts from a kind of objective standpoint. So we've actually worked on measuring all those different outcomes and kind of packing them together with the trainings we were providing. And over the course of the first 2 years, we found that we've trained thousands of older people in San Antonio, raising their technology skills, increasing their connectivity, increasing the capacity of the partner sites that we're working with, including the Housing Authority, and also increasing our sort of our accountability measures to make sure we're making a difference. So thousands of older people got more connected. They got more connection to technology and support. And at the same time, we started working on this model called Catalyst Partnerships, which is really about supercharging our relationships with partners down there to get kind of non-incremental outcomes from it. You know, if you partner with a big organization, we can bring our specialized knowledge, but that organization can actually multiply the effect by providing it through their institutions. And we've had partnerships with the food bank and other organizations that are doing that as well. So there's a combination of individual change and some organizational progress that's been going on down there. And frankly, I think we're just getting started. It's a place that we intend to keep working there for years.
And the organizational effect that Tom talks about is really modeling the way when we think about partnership, breaking down silos so that people begin to work with each other and recognize that part of the solution, sustainable solution, is working together and creating systems together that allow the syndication of solutions in community.
Excellent. So in both of your answers, I hear kind of an underlying theme of building trust. I think building trust is important when you're working with people and when you're coming into a new community as an organization that wasn't there before. So the process of building trust, how did that look in San Antonio?
You know, it's a really great question, Jasmine. Anytime that you come into a new community, especially as a nonprofit, but frankly as any institution, there are always some challenges around competitiveness, right? There's a whole group of nonprofits there. They have city contracts or philanthropic relationships. They're corporate partners there, and you know they see us as a group based in New York City, and nothing can erode people's trust more than arriving in another state and telling them that you're from New York. They all look at us. I actually knew somebody, I am not making this up, I knew somebody that had a button, and the button they would wear at the conference, and the button would say, "I don't care how they do it in New York," which I thought was just absolutely classic. So the trust issue is a really big deal for us. And so the first element in building trust is when you arrive in a new community, you have to ask questions. Don't come there with all of your answers. Don't come in there acting like we're the big experts and no one else knows anything. One of the reasons we picked San Antonio was because they have capacity and they have expertise. And so we came in a learning mode. We spent a lot of time traveling around the neighborhoods. We hired local people to work with us. We didn't bring our curriculum in, carte blanche and start delivering classes. We spent quite a bit of time getting to know people. So that was one. The other side of the trust coin is collaboration, of course, where you start working with people in a way that's mutually beneficial. So we don't have to overlap with other people's programs. We don't have to compete with them on nonprofit grants over certain things. We can just stay in a lane that we pick and enhance the programming that people do and bring in a lot of outside resources, right? When we came in, the Humana grant was a real opportunity for us to do that. But since then, we've actually raised millions of dollars of additional money from outside of San Antonio that we were able to bring in. And then the last part of trust is just honesty. It's just honesty. It's honesty about who you are, where you're coming from and what you're trying to do, and how it's going. You know, we've got a sector here in the nonprofit world where too often there's a tendency for nonprofits to be pushed into a kind of a corner where they have to exaggerate their outcomes, or they have to, you know, just talk about the work they're doing, but not talk about whether it's really making a difference. And when you go into place and you tell people, these are the results we're finding, these are the outcomes that we're working to achieve, and here's some areas where we're succeeding, but other areas where we're not, that level of honesty and ability to reflect on your progress, what you're doing, that really builds trust with partners as well. And so the partner part of the equation is in some ways the most challenging. I can talk more about the senior side of the equation if you want, but I'll stop there for a second. I want to let Walter weigh in here.
Yeah, from a foundation perspective, there's obviously a power dynamic that foundations have to work with because people want what we have, which typically is they only think of as money. They don't recognize that we have other forms of capital that we can also contribute, which we refer to as SMERF capital: social, moral, intellectual, reputational, and financial. So the first thing that I encouraged the team to do here was to get proximate with the community, you know, to push your chair back and get out of the office, establish relationships from a very organic perspective, try to understand, try to listen as much as you can to what the community is telling you, let them reveal who they are, and try to understand how that differs from who they think you want to see. Because there is a difference. When they recognize that you are coming from a foundation, they always think there's certain things that you want to see, and they kind of hide certain things. And we really want to show up in the most authentic way that we can so that they can also show up the same way. So trying to reduce those dynamics as much as we can is very important by just listening and understanding what is it that you're experiencing. How did you get here? Without trying to place any value judgments on anything, but just trying to understand.
That makes sense. Speaking to the idea of showing up authentically and, you know, pushing your chair back and actually getting out into the community, I'm sure that the pandemic has had a big effect on the foundation's ability to do that. Can you speak to how you all have been working through that during the pandemic?
It has allowed us to accelerate some things that we probably would have taken a little longer to do. One of them being remote workers. We now have staff that are in Houston and Washington, D.C. Those aren't the markets that we're targeting at this point, but they're resources that we have in the market that give us that proximate intelligence that I just talked about. And so we're doing that. That's one thing that we've done. We also are virtually meeting with leaders of our investments to understand how they are seeing and dealing with the pandemic. One of our investments that we gave to last year was the community foundation environment. So we have 24 community foundations that we gave money to help deal with COVID in their markets. So we've had conversations with them, all bringing them all together, which is the first time that's ever happened with them. So we're learning together, sharing best practices, and thinking differently that way.
And Tom, how about you? How has the pandemic affected the work that OATS and Senior Planet are able to do?
Well, it's been a real challenge for everybody. First of all, it's created an enormous amount of stress and strain on the staff and the people that we're working with. And so you know, in an environment like this where so many people are suffering from their own sense of pressure and isolation, so many of our people are, you know, they're working from home. They've got kids taking school classes right next to them. They're kind of trapped in their apartments. And so it's created a real desire, a real need for us to increase our level of patience and tolerance and support for each other as a team. And I think that comes first. A lot of our calls start with, how are you doing? And having to acknowledge that people are not always doing great. We have a whole group of staff down in Texas right now that just went through the crisis with the storm. And in a moment like that, I was talking to one of the team members and said, you know, I'd love to get in a, you know, I would normally get in a van and go down there and, you know, help you guys clean up or do something, but we can't do that because we're trapped in this inability to help each other physically. And so that's a real hard thing to manage through. And as a leader, it can be very frustrating for me, and I try to just kind of at least communicatively express that we're trying to help each other and be as supportive as we can. Sometimes giving people a little extra rein and support there is useful. In terms of the program itself, we were a little bit ahead of the curve here at OATS because we were already moving toward what they call a blended learning environment before the COVID crisis hit. OATS started as a grassroots organization in Bedford-Stuyvesant in Brooklyn in 2004. And I used to traipse around the neighborhood with a notepad and sit down with people in their public housing developments and on the porches and stuff and write curriculum that was really relevant to people. But over time, we developed this really great program that was very high touch. You know, we would have 15 people in the classroom. They would come twice a week for 10 weeks. And the transformations were really extraordinary. But we were challenged with this question of, how do you take what we know how to do at the grassroots level with a group of 15 people, let's say, and how do you then bring that to scale so it's working with, say, 1,500 people or 15,000 people? What kind of program adaptation do we need in order to make that kind of a transition? So about 2 or 3 years ago, we started doing some research on online education, and we adopted what's called a learning management system. The program that we picked is called Absorb, which is pretty good. And it allowed us to take some of our curriculum and put it online and have people starting to take supplemental classes and training so that even though they were in the classroom, a lot of the activity and the work they were doing was also available online. We would have for example, we have an entrepreneurship course at Senior Planet. And the entrepreneurs taped all these incredibly inspirational and educational mini segments about what it means to be an entrepreneur when you're 70 or 80 years old. And they gave them all sorts of really cool tips and tricks and things, and it was great. And we actually matched up all of those learning management modules to our online our face-to-face classes. So when COVID happened, all we had to do, we had to, stop teaching face-to-face, take that portion of the curriculum and adapt it into what we already had online and start managing it through that model. So we were able to do that actually very quickly compared to other organizations because we already had the infrastructure in place. Within a couple of weeks, we were already teaching basic classes, and there was, of course, an incredible demand for Zoom classes. We started partnering up with organizations, certainly Humana, but also AARP. We had 10,000 people on some of our Zoom sessions last summer. It was incredibly robust. We taught 178,000 people online since we started this program. And so the volume has really increased, and it's really changed a lot in terms of how we have to think about helping and working with other partners, the advocacy programs, and everything else we do.
So something else that's big that's happened since the start of the pandemic, recently OATS released its Agingconnected report in partnership with the Humana Foundation. So I'm hoping that you all can talk a little bit, or maybe a lot of it, about the report and its findings and why it's particularly relevant right now.
Well, I'll start a little bit. I think what Tom just talked about really is this idea of seniors being a societal resource that's waiting to be tapped, not ignored. Right? My dad just turned 80, and he always tells me that aging is a privilege. But it shouldn't mean that your world dies before you do, right? And so it should mean that you should be able to connect in the way that you need to for your best health. So for me, this report is about removing an unnecessary barrier to best health for a population that we cherish, which is our seniors. And when you think about from a social perspective, what I just talked about, when you think about from a determinant of health perspective, there's really a strong alignment between what OATS is doing in terms of the social impact work around digital connectivity in older adults and the Foundation's goal of social connectedness. So this is the first report that was released under my tenure in partnership with the corporation because this is a hidden crisis, a connectivity crisis that needs to be discussed. It's disproportionately impacting older adults over 65, and the research really revealed that. You're talking about nearly 22 million people. That's the state. That's basically the size of Florida. So it's a population that we're talking about, 22 million people, the size of Florida, that are basically aging, and their world around them is dying before they are. That should not be happening. It's inexcusable. And so we really want to use this report, the framework that this report represents, to begin to tell a story that shines the light on this hidden crisis that no one's talking about. We hear more about the homework gap. which is about children not being able to connect to broadband to do their homework. And there are 5 million of those. I'm not trying to pit age groups against each other, but this is a significantly larger population that no one talks about, and that shouldn't be the case.
And I have a few things to add. First of all, thank you for saying that. I really, the importance of bringing older people together as an asset for our society can't be overstated. It is to everybody's detriment that older adults are excluded from the digital participation that we're talking about. It's not a favor that we're doing to seniors. It's a favor that we're doing to ourselves as a society. We need people's passions and people's creativity and their productivity and their social engagement in order to live well ourselves. And that's a task that confronts everybody. The reason that this report is so groundbreaking and that I was so excited to be able to work on it is that somehow for 20 years, I've been doing this work for 16, 17 years now, and I've read a lot of studies of technology access and technology disparities in the United States. And amazingly, they all say that older people are not online or they struggle in some shape or form, but no one has ever sat down and said, what do we actually know about what's going on for older people compared to the rest of the population and as a group? How many are offline? Just looking at it, the age cutoff, we had to sit down and say, what age cutoff are we going to use to measure the digital participation rates? And we decided that 65 was a good year to use as a threshold. But even just a simple question like that, most other studies don't really have an age cutoff where you can look at the data and find out what's going on for older people. So we had the first ever chance to do this. We hired as collaborators these two really, really well-respected researchers that have deep expertise in tracking the digital participation rates in the U.S., but not just on the technology side, but also on the social side, looking at what's happening in the relationship between isolation for older people and their health outcomes, and what's happening in terms of the demographic factors that overlay that those patterns of non-participation. It's not a technology problem. It's a people problem. And so we wanted a survey that was actually going to embrace that and ask those kinds of questions so that we could see who are these folks. And, the first takeaway is simply the scope of the problem. I mean, imagine the whole state of Florida living in a completely separate universe from people that are online. Just what that would feel like. Imagine for those of you who are on this session today, what it would be like to wake up this morning and not be able to check what's going on digitally on your phone or your computer, to not be able to send an email, to not be able to purchase some supplies that you need for the house online, to not be able to sign up for a vaccination appointment, to be hearing from people on phone calls, oh, we were all on a Zoom call, but you were not on the Zoom call because that wasn't available to you, to be hearing, oh, yeah, you're watching TV and it says, oh, yeah, just go to the website and get that information. But you can't go to that website. And imagine what that feels like for people who are already grappling with a society that has a lot of ageist tendencies that put people under pressure. And so it's really frustrating for people. And this report gives us the first real snapshot of the scope of that problem. And I'd love to talk in more detail about some of the other findings, but just the sheer size of it, 42% of people over the age of 65 do not have wireline internet at home right now.
Which is a really astounding number. Can you talk more about that number, and can you talk more about, is that based on affordability, or are there other factors at play there?
Sure. Walter, can I take this one?
Yeah, go ahead.
I'm talking too much. If you think I'm talking too much, just wave your hand around over there. I'll let you back in here. But I'm on a roll. This stuff makes my blood boil, I have to say. So, the factor here for people is that, what's going on is they are, the cause of the problem is not a simple silver bullet problem. For many people, cost is a factor. And, you talk to politicians and some leaders in the corporate world, and you say, geez, people can't afford the internet, and makes them a little bit uncomfortable because it suggests that the country is failing to provide cost-effective internet to people. But when you talk to people behind closed doors, talking about the trust factor here, everybody admits we have a cost factor. It's too expensive, and it's certainly too expensive for lower income people who can't afford the market rate prices, which can be $60 or $100 a month. And so we have this cost barrier for people. Now, the people doing the most work on that, by the way, are telecommunications companies, and now the federal government's gotten into the act that's trying to solve the problem. Comcast, for many years, has run a program called Internet Essentials that provides $10 a month internet connectivity, originally for kids. We love that, very important. But they extended it to older adults, and they're actually lately extending it to almost half of older people in America who live in Comcast areas turn out to be eligible for that program. I'm not trying to sell Comcast here, but the reality is they've got a program that is available. And one thing the report studied was that the scope of that particular private program, Internet Essentials, does reach a lot of people. The federal government is also getting in now, just passed a subsidy called the Emergency Broadband Benefit, which is also helping to address that cost factor. But cost is not the only piece of the puzzle. The other two legs of the stool here are access, simply having internet at home. And many people still lack internet at home, especially in rural areas. If you go to rural parts of the country, and there are 1,889 counties in the United States that qualify as rural. So the majority of the country by landmass is very rural. We're talking about, tens of millions of people. They are struggling to get online because it's very expensive to run internet to those communities. So there's a real challenge around the equity issues about rural versus urban. And as a country, we cannot let our rural communities fall behind as if somehow they don't matter. With telephone access, there was a whole commitment to universal service that was made 100 years ago, and it's still the case, but the internet hasn't yet caught up, and so we have to make that connection. And then the last piece of the puzzle, which is where OATS really does our special work, is around what people would refer to as the value proposition. Why does somebody who's 80 years old, who's never been on the internet, why would they want to join? Why would they want to start up learning these things? We need to go into these communities on the ground and make that case. We need to help people understand why it's good for them, what they get out of it, and then train and support people in making those choices and using the technology right through the adoption process so that they can get online. And right now in the United States, we've only scratched the surface of solving all three of those problems.
And I think what it really speaks to is what I said earlier. These are societal resources waiting to be tapped, not ignored, right? And so you have these resources, this cherished population that is being ignored, and it's actually affecting their ability to receive critical health services and resources. So that's the health consequence of this, if you think about it. So understanding the potential risk of loneliness and isolation to health outcomes makes addressing them a critical component of a public health response. So it's really informing a public health response that potentially can have a huge impact on a number that we've never heard before. This report reveals this number, 22 million, that we've never heard before. So it begins to, like I said earlier, develop a framework that we can use not only to storytell, but to develop collaborations and partnerships with other organizations focused on these issues to really create an impact and make a difference.
Absolutely. And those health risks are certainly more profound right now than ever before. So I want to ask both of you this. Now that we have this 22 million number, what are we going to do about it?
Yeah.
Well, that's why you work with people like us, I guess, because we're activists. So, we work on the ground and we've got a ground game. So the plan is there's a few different pieces of the puzzle. On the one side, there are resources available to older people in America to help them get online, but they don't know about them and they aren't sure where to find them. If you're an isolated person, of course, we have to come find you and help you find out about these resources. That's one of the challenges of isolation, right? So on the one hand, we need to raise a real awareness campaign that needs to be absolutely universal so that people can hear about resources that are available. Talked a little bit about Internet Essentials. I talked a little bit about this emergency broadband benefit, but let's drill into that for a second. We were talking about Catalyst partnerships a little bit earlier. The subsidy that the federal government has just passed, the $50 a month subsidy, it can help people get on the internet, but it's only going to work if people find out about it. and you can become an enrollment partner to help people get engaged. And so we're going to be working with Humana, the Humana Foundation, and our whole network of institutional partners, which goes all the way down to these community organizations that we've been partnering with around the country that are doing senior services on the ground to help them learn about these benefit programs that are available that allow people to enroll at lower cost prices that are really subsidized, so that seniors themselves who can't afford the internet and maybe were challenged by that can make the transition. And then the other part of the equation is to help people as they make the transition get the training. So OATS is packaging together a whole bunch of different kinds of training materials that are designed both for customers, for the end user, but also for a caregiver and also for an organizational partner, right? You may have your son or daughter who wants to help you get online, or your neighbor. That person needs resources to help you make that transition. So we created a website together with Humana called Agingconnected.org, and people can go there and put in their zip code and actually find out about whether there's a low-cost internet offering there, but they can also connect to resources that OATS is putting together that allow people to get the training and the information. Somebody might say, what kind of tablet should I buy for myself or my mother? What sort of platform should they be on? How much money do I need to spend to do this? Some people need the questions answered simply like, what is connectivity and what's the difference between, Wi-Fi and cellular and things like that. So we're working to solve that information logjam right now. And then the other part of the equation is actually increasing the access for people. So we're going to be working with some of these larger telecoms companies, the Comcasts and the Verizons and the T-Mobiles, but also groups like Starlink, which is Elon Musk's company, to say, you're putting resources out there that are available to help people get connectivity. Can you create some targeted offerings that can serve older adults so that we can start bridging those relationships and those gaps? We see ourselves in some way as kind of dot connectors in this social system right now. Our goal is to get 1 million older adults online by the end of 2022, which is very daunting. But on the other hand, with some of the kinds of partners that we're working with, some of the opportunities that are coming together with the technology and the resources, I think we're going to get there.
I know we're going to get there. We're going to exceed that. The goal, like Tom said, is 1 million engagements, people that are basically having access, improving their access to digital, and also increasing their engagement for digital. But the reason we're doing this, you talked about the health consequences. Typically, we hear about anxiety and depression as increasing as a result of this idea of loneliness. But it's bigger than that. People can actually die. It's deadly. I think you know that loneliness is the equivalent of smoking 15 cigarettes a day. We also know that loneliness increases a person's risk of premature death, including a 50% increase in the risk of dementia, a 29% increase in the risk of heart disease, and a 32% increase in the risk of stroke. So there are negative health consequences to this that we are trying to avoid.
That's right. Isolation and loneliness really can have some serious health impact beyond what we normally think of in terms of anxiety and depression. Something that I thought about while both of you were talking just now, in terms of people that are isolated, people that aren't online currently. How do you find these folks? How do you connect with them to try and get them online? Is it through accessing them through their networks, their children, their churches, how do you reach folks?
Yes.
Keep going.
Keep going.
You're on the right track. Yeah. Okay, Jeff.
You're on the right track.
There's a quiz at the end. We already said there's a quiz at the end of this call. So the quiz is, how many different ways can we connect to people that are not already online? These are, the real channels that we're talking about. Some of them are the public information channels, television and radio being principal. We do a lot of work with media. This Agingconnected was on the Today Show yesterday, and the Today Show ended with the screen showed the Agingconnected website. And I can tell you our phones are ringing off the hook right now. We've got thousands and thousands of people calling. So part of it is using the media effectively and highlighting the urgency of this and the presence of the solutions that are really available to us. There's a kind of a once-in-a-lifetime opportunity to make a massive social change right now, and a lot of people are starting to recognize that. And so that media channel is critical. The other channels include things like, speaking to some folks over at Humana the other day, there are clinics all over America now where we have these community-based health clinics, and people are providing folks with a variety of services that are not within the traditional healthcare sphere, but are more oriented around social determinants of health. And so making sure that they get access to food supports and transportation and things like that, and getting people empowered to support people in learning about technology and the transition to connectivity is one of those paths. And so the partnerships become really important, and embedding some of these efforts in those relationships with, the American Society on Aging has 5,000 community organizations that are part of that operation. The National Association of Area Agencies on Aging, I think, has 10,000 organizations that are affiliated with them. So using some of those umbrella groups, challenging them to get the information into the community, and even providing some supplemental funding in terms of things like challenges or contests or prizes to get people to really socialize the process here. It's really using all the different channels and seeing which ones really start producing results.
I think the pandemic has probably made it a little harder, but that was one of the biggest issues we recognized when I started working in this space was how do you find people? A lot of it is about activating the people that you have in your network. Recognizing who you recognize as maybe having fewer connections than they should, and taking the time to reach out to them, develop a connection, connecting them to resources, connecting them to people, and doing it that way.
And that's really a beautiful call to action for anybody that is listening to this right now. So again, will you tell us again, Tom, the website where people can go to find resources that they can maybe share with older folks that they know?
It's Agingconnected, agingconnected.org, and it's got information right there with a zip code finder. We partnered with an organization called Everyone On that built a national database of all of these affordable internet connection programs. So you can put a zip code right in there, and it'll let you know if you're eligible for something right in the community. And it also gets people started in terms of processing the information required to get somebody online. It's being designed for something that primarily is going to use a buddy system, because obviously older people who are trying to get online are going to need somebody to help them in that first stage. So we're setting it up as something that really empowers that support mechanism, whoever it is, if it's an individual that's just a friend or a volunteer, but it could be a professional, somebody that's working with somebody in a residential facility or their healthcare provider. Anybody can do it. And one thing to mention, just from my perspective, is that everybody needs a purpose. Everybody wants to improve the world. And anytime you pick up the newspaper, you read these terrible things that are going on around us, and there's a real need to turn that corner. And I know it takes time and patience to get somebody over the age of 50 or 60 or 80 or 90 online. But if you spend a month or so working with somebody, a little bit of coaching and help them, periodically, shape them, and they can get access to the Aging Connected resources, that person will change their life. It's almost like teaching a person who didn't speak a new language in a foreign country suddenly to become, conversant, or teaching somebody who can't read how to read. It opens up a whole new world. So the value and the return on your time in terms of giving a person a new lease on life is really profound. And one other resource that's very important in addition to Aging Connected is called Senior Planet. Senior Planet is the OATS website that we designed for older adults. Senior Planet has daily programs and training for people. They're targeted at people over 60. They're open to anybody. They're completely free. And they range from fitness classes to financial management courses to how-to things on Zoom. We've got a book club. We have a comedy routine night that went on recently. There's just an amazing community of older people coming together there. So for first-timers, seniorplanet.org or agingconnected.org, and we operate both of them. But those are really important resources, and I think people who have a little bit of commitment and time can use those to make a difference for one person, and certainly more if you've got the time.
Wonderful. Well, at this time, I would like to open up this conversation to people that have been viewing, that have written questions in to us while we've been chatting. Once again, if you are connecting from inside Humana and you have a question, please feel free to send it over Buzz. Folks that are connecting from outside Humana, if you want to email the address that's there on your screen, those emails are being sent to me, and I will be happy to ask the gentleman here on the screen. So the first question that we have received is about the project in San Antonio. When planning and executing the project in San Antonio, did you work with the local area agency on aging? Have you worked with other area agencies on aging? And this person says they have some of those agencies as clients and see many potential synergies with such a collaboration.
I was just talking about them yesterday. The area agencies on aging are, as a category, probably the largest and most important resource for reaching older adults in communities in the entire country. There are thousands and thousands of them. Every county has what they call them AAAs, and it's not the AAA travel service, it's AAA agencies on aging. But, you know, we started out working with the New York City AAA agencies, and they're all nonprofits on the ground. They partner with a public agency that's local, and they receive money from the Administration for Community Living from the federal side. And when you're trying to reach older adults in a community, the first place you go is the AAA. And the interesting part about it is all of those groups on the ground have nuanced understandings of what's going on for older people in their communities. And so they have cultural competency, not just about aging, but also about whatever segment of the population of older people happen to reside there. One of the things that's critical to understand working with seniors is that it's not a kind of homogeneous population. Older adults across the country reflect all of the diversity of America, and the AAAs are really able to really adapt and customize programming that are really relevant to people where they live, with the kinds of cultural and other kinds of conditions that they're bringing to the table. And so the AAAs have been big partners. They were actually the first people we called in San Antonio, and they've been a big supporter.
Okay, wonderful. The next question we have here is, do you think a technology learning program would pair well with a Medicare Advantage plan?
I do. Walter, do you want to get at this, or should I go for it?
Go for it.
All right. I will. I just spoke to somebody that's doing a Medicare Advantage plan recently, and I don't want to, they asked me not to like share the whole thing with them, but basically, yes, the answer is Medicare Advantage plans could be paired up with technology education and technology access programs. There's actually quite a lot of recent flexibility in terms of how people spend some of the resources within those plans in terms of you know, some of the money that's available for social determinant support. And so we've actually partnered over the years in New York and also in other states on projects that are kind of teamed up with Medicare Advantage plans. There's no reason not to. And they're because they tend to have you know, sort of fairly large populations by region. If you partner with some of the leading agencies in those environments, you can reach 100,000 people. And so it's a great channel, and it's because people are looking for a kind of like a pooled health benefit for people where everybody is able to flexibly apply resources to stay healthy and to be preventive in terms of diseases. Technology plays a role there, and it can be the investment in an internet connection or the training or support or content access for people can keep people out of the hospital. And so it's definitely one of those kind of natural partnerships that we're working on building.
Okay. The next question we have here, I believe this is asking about the report. How do you track digital participation? Or how did the researchers track digital participation?
I'll give the technical answer. I also want to piggyback off my previous answer very quickly. Of the people who are offline, of that 20 million, a third of them are not low income enough to qualify for a public subsidy. So when we're thinking about working with a Medicare Advantage plan or other kinds of programs, they're not all poor. About a third of the seniors that are offline partly because of that value proposition or the anxiety around learning or access issues, but it's not because, historically they have very, very, very few resources. They hypothetically could pay a little bit for some kind of service. In terms of measuring how a person is on or offline, we used two measurements. One is the American Community Survey, which is a survey done by the census. It's not the decennial census that comes out every 10 years, but it's an annual survey that they do with a sample. That survey does ask people if they have a computer. It also asks people if they have internet at home, and it asks them whether or not that internet is wireline internet, which means we are able to separate out the cellular service. We chose wireline internet at home as the sort of threshold standard for whether a person falls into that group of 21 million people. The reason that we did that is a lot of the cellular programs right now have data caps. And so when a person hits a certain level of data use, it starts to throttle or it shuts them down. And so the wireline services typically don't do that, and people are able to participate in online activities with a relative degree of freedom. And then the other thing that we tested with a second database was there's a database called the Nshap Database, which is a panel study done every 3 years with a group of older people. It's 2,500 different people in the survey. And they also ask if they have internet at home as a straight up question. So we did a second run of data from the Nshap data to look at the patterns, and they very closely mimicked what we found from the census. Still have that 42% offline number for people, and it follows pretty similar contours in terms of the demographics.
Okay, and that's the next question. Excuse me. The next question is actually about the report findings, and it asks, how do they differ by demographic? Is there any breakdown there in the report?
Sure. Is there anybody on this call who has a background in statistics? We did a survey. We asked this professor at Cornell, Professor Aaron Cornwell, York Cornwell, who's a brilliant researcher in the sociology department, to look at the demographic factors that overlapped with digital participation. And what she did was there are variables that we look at in the data set. Variables included income, it included education, it included race, health status, whether a person reported that they had poor health or good health, whether the person lived alone by themselves, whether they were on Medicaid, whether they lived in areas with high concentrations of poverty, gender, and disability. And so we looked at all those different variables, and she created what they call logistic regression models that do what they call odds ratios. So you can compare a standard within that question. Say you want to look at people by college education, for example. So you look at people that graduated from college, and then you compare the odds ratios from the other categories about whether or not those people would be more likely to be offline. And it turns out in that particular category, if you don't have a high school degree, you're 17 times less likely to have internet at home than if you have a college degree. And if you're low income, you're 10 times less likely to be online than if somebody that has the average income threshold, the average income category. If you're African American, you're 3 times less likely to be online than if you're white. And if you're Latino, it's 4 times. So we were able to calculate those variables. And we were also able to do what they call multivariate analysis, where you put all of the variables in an equation at the same time, and that allows you to kind of tease out the independent factors that may relate to each of those bivariate relationships. So we were able to find that, in fact, the same general demographic conditions held depending on where and how we were looking at it. We still found that big predictors were race, income, education level, health status, gender had a factor, living in a rural community was a factor, and they ranged anywhere from about 1.6, 1.7 times less likely to be online, all the way up to that crazy number with people that have the lower education attainment, where they're 17 times less likely. So there's a real spread of impact for people.
Tom, where's the copy of the report? Which website is that on? Your OATS website or Agingconnected?
It's on every website that we control now, I'll tell you that.
Okay.
The easiest place to get it is if you go to agingconnected.org, it'll say the report. You click on that.
Right.
It's got a PDF that you can download and look right at. But it's also on Senior Planet actually ran a piece about this, so you could probably dig it up on Senior Planet. And the last website, I hate to give you guys a million websites to look at, but if you're interested in learning a little bit more about what we do at OATS, which is the parent nonprofit for Senior Planet and the sponsor, together with Humana Foundation of this project, my nonprofit, Older Adults Technology Services, is online at oats.org. And that includes also a reference to the report under the section on our white papers that we've written, along with a lot of background in terms of the kinds of projects we've worked on that led up to this effort, so that people can contextualize what we're trying to do with what we've been doing in the past.
And we have one final question that I hope we'll have time to answer quickly. What do we know about which technologies and concepts are the most practical for people over 65?
I have to take this one too. Sorry, Walter.
Oh, go ahead.
We have found, when we first started out, I wasn't sure which technologies to focus on. And a lot of people were telling me, they had all these terrible stereotypes about aging. They would say, well, seniors can't learn, Gmail. They can't learn how to use a PC. And we thought, well, let's go test that out. So we went out in the community. We asked people to try out different devices and different applications and environments. It turns out that older people learn and thrive with the same exact devices that the rest of the population learns and thrives with. So we recommend that people look at the most suitable device for a person based on their user patterns, their social environment, and their economic ability to pay for things. So if everybody is on Chromebooks, then we would recommend that the older person, if they feel that that's fitting their user pattern, get on Chromebooks, because a Chromebook is what your friends and family are going to be using. A lot of people use Apples or iPads. If most of the people that you work with are on an iPad and you can afford one, that's a great device for older people. So OATS trains on Chromebooks. We train on PCs. We train on iPads. We also train on T-Mobile G-Pads, which are part of a project we did with the city of New York to give away 10,000 tablets last year. But our feeling is that any mainstream device, and the applications are email, texting, internet surfing, the same applications that are most popular with the general population. Maybe not so much TikTok lately, but they're catching up.
They're catching up.
I'm not even on TikTok.
My 83-year-old uncle just made himself a TikTok account. So yes,
wow.
They are catching up.
Talk about our slogan at Senior Planet is aging with attitude, and that's aging with attitude.
Absolutely.
Yes, he's trying. Well, I think we are about out of time, so I want to thank everyone again who tuned in today. We really appreciate your presence and your thoughtful questions. Thank you, Tom and Walter, for your insights, and also thank you to everyone else who helped pull together today's event. For those of you that tuned in, you will receive a survey after the event asking for your feedback, and we hope you'll give it so we can continue to improve as we bring you future installments of the Humana Foundation Symposium series. I also wanted to let you know that today's event has been recorded, and it will be available on the Humana Foundation Buzz, and will also be emailed to everyone that attended. And we hope you will stay tuned to the Humana Foundation website and to our Twitter for updates as we move along.
Thank you, Tom. Thank you, Jasmine.
Thank you, Jasmine. This has been really great today. Really appreciated your letting us participate.
Thank you.